Good morning, everyone. Thank you all for joining this morning. We'll go ahead and let people get settled into our space before we get started. Good morning, everyone, again. Thank you for joining. Quite a few people still joining us this morning, so we'll go ahead and let them get entered into our space. I'm going to go ahead and also put our demographic form link in the chat. If you could go ahead and take just a moment and fill that out. Again, it's 4 questions. It gives us an opportunity to get an idea of all the individuals that we're serving through the work that we do at UW-Madison Division of Extension. You can always select prefer not to respond for any one of those questions. Let us know if you have any issues opening that link this morning. Good morning again to everyone that's just joining us now. I did go ahead and just put the demographic form link in the chat again. If you could go ahead and take just a moment, complete that demographic survey for us. We will get started in just a few minutes as we get everybody settled into our space today. Jake, if you want, you can go ahead and share the slides, and then I will keep us moving forward as we have a few people still joining. Fantastic. And as everyone gets settled, we'll just introduce our team again. Thank you for being a part of the work that you are doing in your counties and your local health departments with the tribal nations. As a part of our team here at UW-Madison Division of Extension, we have Jake Rademacher with us. He's a graduate student supporting our work. We also have Jen Braun, our health equity specialist. Debbie Moellendorf is a behavioral health educator. And Amber Canto is our Institute Director. My name again is Danette Hopke. I'm the Behavioral Health Program Manager, and I am grateful to be here and in this space with all of you today. And we're also grateful to support the work that you are all doing in your counties related to adolescent well-being. And again, we'll just give people a little bit more time. We know that it takes just a bit for everybody to get into this space. Remember that it's noon. Our call is starting. All of those things. All right. With that, Jake, if you want to skip to the third slide, I think, oh, there we go. There are all of our names on our team. We are going to give ourselves an opportunity in this space to engage in some grounding, a little bit of self-care as we get our time started. As a part of a recent office hours session and through some conversations that we've had with health department leaders, DHS staff, we really have gained an understanding of the level of transition and understaffing and stress really that health departments are facing. And so as a part of that, we have had some conversation on our team and with Maggie as well about prioritizing an opportunity for some self-care in today's session and potentially in sessions moving forward as well. So if you'll all give me just a bit of time to give you an opportunity to do that. Before we begin today, I want to give you an opportunity to ground yourself in this space and in the time that we have here together today. I know that it's easy to join a Zoom, to plan on multitasking in order to get as much as you possibly can get done with the time that you have. And instead, what we do often is contribute to our level of digital fatigue. And we really rob ourselves of the opportunity to be fully present in the moments that we're given and the time that we have here today. So as we get started today, I'd like to invite you to find a piece of paper, maybe a scratch piece of paper, a sticky note, whatever it is that you have handy and close. And I'm going to give you about 90 seconds to just write down all of the things that are in your head right now, that are calling for your attention, that are maybe urging you or encouraging you to multitask during this time. Maybe it's actions to do, just thoughts. So I'm going to give you 90 seconds again. Just take some time, write those things down on that piece of paper. And then when you're done, I'm going to invite you to just turn that piece of paper over and set it off to the side. Go ahead and start that. All right, so go ahead and get those last few things that are in your head down on paper, and then go ahead and take that piece of paper and again, just turn it over and set it off to the side. It will be there for you to pick up when you're done at the end of our time together today, or maybe you'll just let those things set off to the side for a while. That'll be your choice at that time. Now I want to take another moment for just a bit of extra self-care before we get into our data and our informational content for our time that we have together today. You could take just a second to, again, find another piece of paper, maybe another sticky note. And if you don't want to write it down, that's okay too. I'm not going to ask you to share these things, But I want you to take a moment and think about 3 things that you are grateful for in this moment. Be cautious not to should on yourself and write down things that you feel like you should be grateful for. Instead, think about the little things or maybe even big things right now in this moment that you're grateful for. It can be something or even someone, maybe your emotions, maybe your just physical sensations that you're experiencing right now. Maybe it's your coffee, colleagues, safe travel to the office, fall colors and flavors. As you recall those things or as you take some time to write them down, just notice also the thoughts and feelings and maybe even your body sensations that come over you as you give yourself this opportunity to experience some gratitude. Take just a moment to do that for yourself right now. You finish that up. You likely already know the research behind gratitude, but I'll just remind you for a bit about the benefits that we can get. Research has shown that people who feel more grateful more often are less depressed, less anxious, they sleep better, and that they're generally happier. And it's not just because that those individuals have more to be grateful for. Researchers have also watched what happens when we recruit people to randomly begin practicing gratitude, and people who do these exercises steadily become healthier and happier overall. All right, and as we get ready to move on, if you're joining us during lunch and you're eating while you're here, go ahead, do that. But while you do that, I encourage you to also just allow yourself to experience the meal that you're eating, maybe the taste, the textures, and even maybe experience some gratitude for that meal that you have. Go ahead and fully immerse yourself in your meal as you enjoy the rest of the time that we have together on this learning community call. So as we get ready to move into the next part of our slides, the data, the content, the learning, and the sharing, I encourage you to take just a few good deep breaths, maybe stretch your body, move your arms, wiggle a little bit, and bring your attention back to the space so that we can start to move forward in our time together today. And with that, here is our agenda for today. We're going to look at, talk about an opportunity to think about the chip-chop processes, tools, and resources. With that, we'll share some data and some information points that you could potentially utilize. We're going to highlight some county efforts that are elevating adolescent well-being. We'll hear from our youth wellness team that's part of our collective efforts overall. We'll have an opportunity to get some feedback from all of you as we prepare for this technical assistance work moving forward. And we really value and need your feedback as we begin to kind of round out what 2024 will look like for supporting you in these efforts. We'll also share our website, some resources and updates. And then, of course, as always, we'll allow time at the end for questions, additional questions for you, and then feedback on this call in particular. Again, your feedback both on these calls as well as the overall process of what we're offering through our technical assistance is really important to us, and we value it greatly. You'll notice that we don't have an update from DHS today. Maggie kind of last minute and unexpectedly was unable to join our call today. So she will identify the best way to share her updates with our team, and then we'll get that information out to you as soon as we possibly can. So we'll look forward to hearing from her quickly and then getting any updates that she has for all of you, rounding out the remainder of the year. And looking forward into 2024 as well. So stay tuned for all of that. We'll make sure that we get it out to you as efficiently as we possibly can. And with that, we're just going to move quickly. I want to set the stage a little bit for the remainder of the time that we have together. If you remember all the way back to April 24th, during our learning community call there, we really highlighted the state of adolescent well-being in Wisconsin. Debbie Moellendorf, our educator, did a fantastic job of really sharing the research and the information, as well as the YRBS data that was newly released at that time. At the end of the call, we're going to give you a peek at our website again, remind you of where you can find those recorded calls. So we're not going to spend a lot of time talking in detail about the state of adolescent well-being, because that learning community call recording did a really nice job of that. So we'll get you back to that information. But what I did want to do is give you just a highlight and an overview of some of the data that we think is really important when we're talking about how can we elevate adolescent well-being as a need in our CHIP and our CHA processes overall. So on this slide, you'll see really I pulled some key highlights from the 2021 statewide YRBS data set that exists out there. These data points are shared as a comparison that you can utilize with your own county data. If you're already working closely with your YRBS, your local YRBS data, that's fantastic. And if that's a place where you could also use some additional support, sort of accessing and operationalizing that data, please also consider reaching out to our team here at Extension. Many of us on our team and our educators across the state have extensive experience working closely with schools and counties around utilizing this data. So again, if you're not already utilizing it, please consider reaching out to us and considering how we could help support you in utilizing your local data in comparison with this statewide data. What you'll see on the slide here is that the DPI has really identified the following groups in those first few bullet points that are really identifying fewer levels of supports and more challenges with mental health across the state. So females, students of color, students with disabilities and chronic health conditions, students receiving special education services, those that are facing food insecurity, students that have moved many times, students who are identify as lesbian, gay, bisexual, or transgender, and then students with low grades, those students in our at-risk grade categories are all showing that they have a greater level of need, and they also are reporting that they have lower levels of supports in addressing the mental health needs that might come their way. Some other overall data that I think is good for us to always be reminded of when we're talking about adolescent well-being in the state is that 58% of students reported experiencing suicide, suicidal ideation, self-harm thoughts, anxiety, or depression in the 12 months prior to that survey being submitted. So again, we all know, but sometimes this data can really help us to be reminded of the prevalence of the concerns and the struggles that our adolescents are facing. We also know that 52% of students reported anxiety, and 1 in 3 students reported struggles with depression. In addition, we know that in the past 12 months prior to that survey, with increasing severity based on previous years, students are also considering suicide at higher rates. Higher rates of students are making plans, and that we've had 8.5% of students attempting suicide in that year prior to that 2021 YRBS survey. As you all know, the 2023 YRBS survey has been in progress, and it will likely be some time before we are able to see that data and those results from the state compilation, but we'll look forward to seeing that as soon as we're able to, and then of course sharing that all out with you as well. We know that that data can be a really important piece of your CHIP and your CHA processes. Here's what else we know about adolescent well-being, is that most students that experience anxiety never get professional help to support them. And for those that do get professional help, the data says that they experience symptoms for up to 11 years before they actually are able to get that support. And we also know that young people in our elementary schools are experiencing those anxiety symptoms at a very young age. And again, enduring them for a very long period of time before they might get those professional supports that are really, really valuable. So when we think about that, we also want to think about what is it that we can do to support the needs of adolescents in our states and in our counties. So as we think about that, and as we think about what we can do related to our CHIP and our CHA efforts, I pulled some information again that has come really from the DPI YRBS data points and their recommendations, as well as from the Office of Children's Mental Health. So things that we can do in our counties, and again, things that Extension can support you with in the work that you are doing, really digging into those local YRBS data sources and using that data for social marketing campaigns, informing school wellness team or maybe school wellness team development. We can also use that information to drive the value and importance behind comprehensive healthy schools assessments, and also those youth-led stigma reduction and awareness groups and efforts that can exist in schools. Those are things that we can be doing. We also can support peer-led youth groups, and by we, I include you all, right? Extension can be a part of that process with you, but these are also things that can be incorporated into those CHIP and CHA plan writing and process development. And in addition, extracurricular activities. One of the things that was really noted in the YRBS this year is that in the absence of extracurricular activities, adolescent well-being decreases. So if that's access to those resources or just not participating in them, we know that those opportunities are really important. And if we can provide extracurricular opportunities, either as a part of school experiences or through community-based opportunities, we can really work to improve the well-being of adolescents in our communities. Also working to ensure that our policies consider the significant impact of the social determinants of health, and how those social determinants have an impact on mental health and well-being overall. Increasing access to treatment by supporting school-based mental health services and expanding those services whenever possible. Also advocating for and supporting mental health literacy and suicide prevention education in our schools. And then involving people who have lived experience with children's mental health in the program and policy decision-making process are really key pieces and important things that we can do to advance adolescent well-being in our state and in our counties. I also wanted to just highlight quickly for you some of the data resources that can be utilized to inform your CHIP and your CHA efforts. We'll share all of these out with you. I want to really highlight the Office of Children's Mental Health just recently in August released the Improving Girls' Mental Health Fact Sheet. It's a really great tool and offers lots of suggestions for what we can do to support and improve the well-being of girls across our state, and there's suggestions for parents, for schools, and for policymakers as well in that space. The Mental Health Literacy Toolbox is another great tool that I found and wanted to make sure that we shared it with you. And again, we will provide links to those and potentially give an opportunity during our office hour sessions to dig a little bit deeper into some of these tools or resources if that would be valuable for you as well. All right, with that, we are going to jump to some county highlights. And to kick off our county highlights, we are going to turn the floor over to Chet Hertz and Elise Anderson from Washburn County. Chet and Elise are actually former colleagues of mine at the county level when I was a county-based educator. And I reached out to them because I knew the breadth of the work that they are doing in Washburn County to elevate adolescent well-being and to address it as a part of their CHIP and CHA process. So with that, I'm going to turn it over. Chet and Elise, go ahead and take it away.
Well, good afternoon. I'm grateful to be here to kind of share our story in prevention efforts as it relates to adolescent mental health here in Washburn County. One thing that I hope rings throughout this conversation is that there's absolutely nothing unique about Washburn County. We are poor, we are rural, and much of Wisconsin looks like that. So I think what we've done here is transferable to just about any community. So I'll kick things off by talking about the history a little bit. and how we got to where we're at. This has certainly been a process that's taken a significant amount of time. In 1987, and to put it into context a little bit, that was the year I was born. There was unfortunately an accident that had occurred, and I hope I'm getting my facts right. It took place during either homecoming or prom, where some students were driving late at night, had been drinking some alcohol, and unfortunately got into an accident and died. The county board at that time approved $7,500 of tax levy that would be allocated for prevention and anti-substance prevention programs and opportunities for youth. That was kind of the starting point, I think, for prevention related efforts here in Washburn County. The second big thing, I've heard it be called the methamphetamine epidemic in the Northwoods. It's been referred to as that before, and unfortunately led to an awful lot of children being drug endangered. That was a huge push to invest in prevention efforts throughout Washburn County to increase resources for young people. And then the last piece I'd like to highlight in terms of our history, and I'd invite you to read through kind of the details here, but really was access to funding. Right around that 2018 timeframe, funding for this type of work, partnership, and capacity really increased, and that gave us the opportunity to quickly and rapidly grow our resources for youth in the community. And I think you can see that on the timeline. This work really accelerated in the last several years. The foundation of our work, I believe, is really rooted in our universal screening process. We utilize the Youth Pediatric Symptoms Checklist. It's kind of a well-known attitudinal survey. Many school districts and counties use it across the state. The Office of Children's Mental Health recently did some work in this area, informing what communities could look like, or what universal screening could look like in communities across Washburn County, or across the state. Sorry, I misspoke. So here in Washburn, we utilize that attitudinal survey, but we have 8 additional questions that really drive at homicidal thoughts, suicidal thoughts, safety and resilience as well. That process has been a bit of an evolution since 2018. It looks a little bit different in every school, but essentially the basics are the student takes the survey, they have a follow-up with a licensed clinician directly after completing the survey, and a 3-month follow-up after that initial contact. And throughout the year, they'll have access to somebody who follows up throughout the year. I wouldn't call it to the level of case management, but they'll continue to make contact with that student and address barriers that they may have in getting access to resources or any kind of services. Some students from the survey will receive a referral, either to traditional talk therapy or one of the many free resources that we've developed over the last 5 years. To get to this place, partnerships are paramount. So before the first youth wellness screen occurred in 2018 here in Washburn County, relationships with our local providers needed to be really solidified, and they also had to have some stake in the game, so to speak. So these providers are offering their services at reduced rates to make this sustainable, for years to come. And those providers are connected to a certain school district. These names and places don't mean anything to you, but we have 4 school districts here, and Northwood is partnered with a Northwood and Birchwood are partnered with a specific agency. So the relationships within those agencies and districts will grow over time, and they have a mutual, kind of goal or benefit with each other. The outcomes that we were seeking in starting this screening process here was to have local data. YRBS is great for understanding overall school health, but we're not able to directly pinpoint a student. With this voluntary screening process, we can pinpoint a student, what their specific needs are, and provide them access to a service that will address those needs specifically. It's really targeted referral for us. It also gave us a better idea of what do we need to do in our community to make it healthier? What resources are youth seeking and needing? And that's led us to be able to grow resources and services, because screening without somewhere for these students to go is a bad thing. There should be follow-up. There should be services in place to support them. In thinking about what our program growth has looked like over the last 5 years, I like to look at it through this lens of like a really simplified social emotional learning or school-based mental health model. This like universal some few, all some few tiered system. And on the right-hand side here, you'll see a generic model that I threw together kind of last second here to demonstrate what I'm talking about. And over here on the left are specific programs that we have in place that fit within this framework. And I'll go into a little bit of detail as I'm going down this list. So we created a youth diversion program that essentially functions like case management. So we have an individual who will work individually with students who are referred by either school resource officers or school counselors, and they'll have unique challenges that they're facing with the school, and that case manager will access resources throughout the county that are specific to that student's need and almost provide like a wraparound service to them. We created a summer leadership training program that changes every year, but it's also targeted for youth who maybe are at risk but still have a ton of potential. And that's a eight-week session, and at the end of those 8 sessions, those youth function as mentors for our summer leadership retreat, which is kind of the keynote of our summer programming. We offer teen mental health first aid, catch my breath, different more targeted skills groups, and we have follow-up resiliency groups to the youth wellness screen. So we found that a lot of students who were producing higher scores, they didn't have the resources financially or insurance to engage in traditional talk therapy. So we created follow-up groups that are free in the schools. We partner with a local provider. They're called Anchor Bay here in Washburn County, and they hold small groups over a span of 6 weeks, building skills with those students. Messaging campaigns, we offer a lot of social emotional learning opportunities as well. We have 2 youth-led advocacy groups, Healthy Minds and City, it's called. I believe it stands for Change in the Youth. And we recently started the process of opening a youth center here that will have its own internal programming built in as well. And then, of course, like any youth center, it functions as a safe space for young people to go in times of need of any kind. That is the 10,000-foot view of adolescent mental health programming here in Washburn County, and kind of in a nutshell view of what prevention work looks like here. I'm happy to provide a lot more detail And I'm sure that Danette would be willing to share my contact information if anyone wanted to take a deeper dive in any of that, because it was very high level and certainly a very brief summary of all the things that have taken place here in our community. But with that, I'll pass it off to Elise, who is going to talk about how all of that connects to our local Chip and Shaw.
Thanks, Brett. Thanks again, Danette, for inviting us to be here today. It's pretty exciting to share about the stuff going on in Washburn County, up in the northwoods of the state. So a little bit of background about our community health needs assessment before we jump into the CHIP. Every 3 years, Washburn County Public Health partners with a local hospital, Spooner Health. It's used to survey the needs of community members and to more importantly do something about that. So we don't just want to take that data, put it in a box and leave it on a shelf for years and not do anything with it. So our organizations throughout Washburn County are very supportive and committed to focusing on the areas that are determined. This past community health needs assessment was substance use, mental health, and access to care. So our community members ranged from a variety of areas. So we have Spooner Health, Essentia Health, which is another clinic, Washburn County Health and Human Services. That's where Chet and I come in. North Lakes, the local library in Spooner, Extension, our county sheriff's office has been supportive, and then our family resource center, which is located in Spooner. So this is a little demographic stuff about our age range, people who filled out this assessment, gender, and where they were from. So as you can see here, 45-year-olds and plus, they were the majority of the people who filled out this assessment. May seem surprising, but Washburn County is a primarily aging population. So working to target outreach more to get responses from the younger folks in our community in the future. As you can see on this side here, the survey was intended to support people throughout Washburn County, while 46% of the people who filled out the assessment were from Spooner. So Spooner is our largest community in Washburn County, and then followed by Salt Lake, which is our county seat. So the 3 most important health problems affecting those living in the community identified from the assessment included drug abuse and overdose, mental health, depression, anxiety, alcohol abuse, chronic diseases, and obesity, lack of nutrition, and exercise. And the opinion of the individuals submitting the assessment, what would improve our community's access to healthcare services. This included urgent care, more primary care providers, more specialists, expanded hours for outpatient services, and transportation assistance. So this is a lot I'm throwing at you. This is just a nice little snapshot of the information we received from those who filled out the assessment. Chet, could you go to the next slide, please? Thank you. Okay, so moving in to our community health improvement plan. So this implementation plan helps us stay on track to reach our goals that came out of the 3 focus areas. So we use strategies and data markers to focus on the specific projects that help reach the goals of the community health needs assessment. So like I said before, the focus areas for this round were substance use, mental health, and access to care. So our goal for the substance use is to provide education, support, and healthy alternatives to prevent substance use and misuse. So like Chet said at the beginning of his portion, $7,500 was set aside from the county board. I don't remember the exact year that was, the year Chet was born. But that funding this past year was used to support local game nights for older adults in our community. As a substance-free location, we have a really fun family fest where we have, I think this past year, we had 105 families come out. So there's a free meal provided, lots of education and outreach, really fun spot for the kiddos to go. So it's a drug and alcohol-free environment for families to have their kids interact with other kiddos. So really great turnout for that. Expanding education and support for healthy alternatives to substance use for the adult population. I know this is focusing on the youth population. So our prevention unit does a lot of great education with all 4 schools within Washburn County, like Chet said, with Kept My Breath. And then educate and promote safer, more effective pain management programs and resources. So the prevention team participates in our drug take back day, and the youth from Change in the Youth the City team, they love participating in that, and they love promoting safe medication disposal within our county. So they like to come out and do education. So that's a really fun way to get our youth involved in that. For mental health, the goal is to implement programs that enhance mental health awareness and increase utilization of community resources that support mental well-being. It's like Ted talked about the Healthy Minds group, that Y screen, connecting students to services right away. So there's action taken there. And then our third is access to care, so increasing access, availability, and awareness to primary care. So this section was more focused on our aging population with transportation. However, in the realm of youth, making sure that we have services that can go in school to meet the youth where they are, so that eliminates that barrier of transportation as well. As you can see on the bottom here, we put a bunch of community resources under each focus area. And so this information is spread out countywide. So our hospital systems have this information, public health department has it, our human services department has it. So we have this posted in various spots. I will also do a quick shout out to our Healthy Wash Co team. We did put it together a pretty big comprehensive list of resources for Washburn County community members that has mental health services, substance use recovery services, other access to care related services where services range throughout the whole county and cross county lines, because Washburn County is really rural. So a lot of services are in like Barron County, Eau Claire County, counties like that. Chad, am I missing anything on this part?
No, I don't think so. You wrapped that up really well.
I will say our team meets, I will say we meet twice a year to go over this, but we do have a pretty interactive and collaborative approach. So we're trying to eliminate competition's not the right word, but we're trying to eliminate duplication of programming throughout Washburn County. So we're all trying to be on the same team rather than fight against each other for some offerings we have.
I wanted to address some kind of key takeaways before we wrap things up here on our end in Washburn County. The process of creating services to address adolescent mental health and substance misuse has been a process that's taken a lot of time. Relationships have, without a doubt, been the foundation for any of this work to move forward. We've partnered with people. We work in the same spaces as, for example, UW Extension here. So we're seeing the individuals that we're working with and doing the work alongside of on a daily basis. As I mentioned previously, the providers that are implementing the youth wellness screen here as one example of our programs, they've invested their own agency funding and time into that process. That looks different for every agency. Some agencies are offering their services for free. Some agencies are offering it at a reduced rate of 50%, we'll say, as an example, one agency does. I think the other piece, and maybe the most important in all of this, is this notion of, if not now, when, if not us, who. Taking the initiative to stick your neck out there has led to the most outcomes for us. We don't have a team of grant writers here in Washburn County. To be quite honest, there were very few people who had grant writing experience in Washburn County in the last 5 years, we'll say. But we didn't keep that from us, or our willingness to at least try for them. And I think that there's probably a small story for every single program that's been put together over the last 5 years is, well, let's give it a shot. What's the worst that can happen? And it continues to pay dividends today for our team as we continue to grow what resources we have here for youth in terms of adolescent mental health. Elise?
Yeah, absolutely. The next point Chet and I wanted to have you guys take away was the importance of emphasizing community voice. We're not doing this to the community, we're doing this with the community. We're helping pull together all the resources to help make Washburn County a healthier community in general. And then the final one being, like I said at the end of my spiel, collaboration, not competition amongst stakeholders. So making sure we're working together and in tandem rather than working apart. So we don't want to be in a silo. And I think post-COVID, I think everyone's ready to get back in and start working together again. I know that it's a really challenging time to meet the needs of the community while doing mostly everything remote.
Well, thank you all for listening to us. I'll be sure to put our the email or the website rather URL for our prevention. We've entitled it Healthy Washco. For you to take a deeper dive on all the things that are happening here, and that there's also contact information if you have further questions. But thank you again.
Thank you.
Chet and Elise, I can't thank you enough for taking the time to be here. And I think Chet said it early on, but when Chet and I were talking about preparing for today and what I was asking them to share, we've often in Washburn County, as he mentioned, if Washburn County can make it happen, anyone can make it happen. And so I think that's why it was so important for me to invite them here and to share their story. So as I mentioned, if anyone has questions, maybe we'll just pause for a quick second. Anyone is welcome to unmute and ask a question or put a question in the chat and give them an opportunity to answer for themselves, or you can reach out to them as well.
Danette, there was a couple of comments in the chat. Somebody asked if the links will be sent out, and yes, all of the links from today's session will be sent out. And then a comment from Kathy is that relationships are key. Thank you for that important reminder.
Thank you, Jen, for seeing those. I appreciate it. All right. Not hearing any more questions, we're going to jump to Shawano County and Shawano-Menominee County Health Departments. We've got Nick here today, and he is going to share just a bit about what is going on. He has to hop off at 1 o'clock, so he won't have a lot of time to talk about what they are doing, but I also want to thank him for giving his time. Our extension educator, Megan Suring, also partnered with me to put together some kind of bullet points on this slide, but I'll let Nick take it away and tell us more.
Sure. So I'm with the Shawano-Menominee County's Health Department. I'm the Assistant Health Officer, and with our MCH objective and selecting adolescent well-being, we have kind of switched from more of a QPR focus that we conducted trainings through our own department to more partnering with an agency that's really existed, or a coalition that's existed already, was we felt like we were kind of stepping on toes and duplicating services. So we spent the last couple of years really supporting ROADS, which is reaching out against depression and suicide. It's a coalition that's really started from just local community members that have maybe lived experience. They've lost family members or friends to suicide. We also have one of our mortician companies is a part of the coalition as well. So we have some unique partners at the table, and they have good relationships already with schools. So the program that they implement is the Yellow Ribbon program, and I would say it's very similar to QPR, as it's a gatekeeper training program. So it's helping others identify signs and symptoms of suicidality and self-harm, and then allowing the interviewer or someone that they can talk to is where to refer them to. So I would say it's very in line with the QPR's mission. However, with our UW Extension and our health department, we both have been trained and certified in QPR. So that is something that we are still able to do if requested from our community, but we're kind of letting ROADS take the lead with Yellow Ribbon and working with that. So some of in addition to doing that in the schools, they also host an annual remembrance gathering. So they invite community members to hear a story from somebody who either has their own lived experience, or they have a family or a friend who have either died by suicide or they've are survived. So every year we do that, and then there's a time for reflection and sharing. It's a time to honor those that have lost lives to suicide, and then just to promote the resources that are available in the community for prevention as well. So that is actually this week for the annual Remembrance Gathering on Thursday night. And then lastly, as we're talking about how this connects to our CHA on the CHIP, mental health currently is one of our 3 action teams, or our 3 priorities within our Healthy People Shawano Menominee counties, our CHIP subcommittee. And I would say, while we have it's overall mental health is the focus, that's there is a strong emphasis on youth within the mental health action team. We're actually starting a NAMI affiliate. Shawano and Menominee counties are one of the only, if you look at the NAMI's map for Wisconsin, we're one of the only 2 counties that don't have a local affiliate really in the Northeast region. So we're trying to change that, and we're starting to lay the groundwork. We have an application submitted. We've been pre-approved to be an affiliate, so we just have a lot of logistical things to kind of get into place. But one of our focuses really is to set up a youth, a young adults support group for mental illness. So that's and that it would be peer led. It would be those that would be within that population, they would be trained, and they'd have to attend a certain amount of support groups to be able to lead. But that is one of our goals, is we feel like that youth component is really lacking in our communities of Shawano Menominee County. So that's a very high overview, but I'd be happy to welcome any questions.
Thanks a lot, Nick, for stepping in to share that information with us today about what you have going on.
Yeah, absolutely.
All right. Next, I'm going to turn it over and see if we have anyone from Rock County that is here to join us. I know Christine was unable to join us today, and she was going to try to see if someone from Rock County was able to join and share the work that they are doing. And if not, I'll share a quick update from Langlade. All right, not hearing anyone. We'll jump to just a quick update from Langlade. Jean from Langlade County was also not able to join today, but she wanted me to share their priorities related to mental health. That you can see them on the slide, their goals, and then really the efforts. She said they've poured a lot of interest and time into working with NAMI to implement the Raise Your Voice program in Langlade County, and she just offered the opportunity for individuals to reach out. If you have questions about the Raise Your Voice program, would like to learn about that implementation and the process and the work that they've been doing related to Raise Your Voice in their county, you're more than welcome to reach out to her as well, and we can share more about the NAMI Raise Your Voice program. Again, it's another program that Extension has been invested in supporting counties and schools with development of that work throughout the state as well. So we're happy to feature that and talk more about that at another time as well. All right, now we're going to move on and hear from our team, our youth wellness team, advisory team, and the Patch Partnership. I'll turn it over to Jen and Jake.
Thanks, Danette. So we're here to provide you just a brief update on what the Extension Youth Wellness Team has been working on. As a reminder, this is a piece of our MCH grant that we're working on for all of you. So the Youth Wellness Team members are being supported by myself and Jake, like Danette had just mentioned, in partnership with Patch. So Patch has 5 locations and 3 fellowships throughout Wisconsin. And they really encourage young people to raise their voices, to create some positive change, and have programs and resources that educate, engage, and empower others to do the same. You may remember our learning community call over the summer, where we had some of the Patch young people, as well as their advisor, Erica, come and share some of what they do with us. So we're still partnering with them around this work. So the youth wellness team is meeting monthly. So we're working to create a plan that uses policy systems and environmental change to address the health equity issue of their choice using the Youth Advocates for Community Health framework. You'll see up on the top right of the screen, we had also talked about Youth Advocates for Community Health, but I believe that was back in February or March on one of our first learning community calls. So what Youth Advocates for Community Health is it's a framework that was developed by Extension, and it helps focus on community change projects that change the systems in which we all work, live, and play. And it really helps to guide young people through these 5 steps of action that you see up there. So members of the team are also serving as reviewers to add their voice and some really valuable input to some online interactive learning modules that are in development by UW Extension. We're creating learning modules around social determinants of health, health equity, and policy systems and environmental change work. And these are intended to have an audience of young people, but they're also very appropriate for adults to use as well. So the young people are going through with a review sheet and determining, what the content that makes sense for them, some of the language that's used, even, some of the design work, what really appeals to them. So Jake, if you can move to the next slide. For our last session, we met in July for the first time. We took August off as Patch has a lot of trainings for their advocates, and we're using those advocates to serve as our youth wellness team. So for our time together in September, we started with an icebreaker where we all put our names, locations, and something really interesting or unique or something that we really love about our community within a Jamboard. So on this, you're going to see just the areas, because we removed all of the identifying characteristics, the names, and some of the pieces that they had around interest in the community. And really what we're intending to doing with this work is work with the young people to determine, what community means to them, as well as where, as we're moving through this work, they would like to focus their energy. So we also, next slide, please, Jake. We spent most of our time together in September determining where they want to focus their energy, like I said, and what communities they'd like to serve. So when we're talking about communities, we're not just talking geographical, like say Sawyer County, or it could also be population-based communities. So maybe they're talking about they really want to work with some of our tribal communities. So this is just an example. We had our team split into groups, and this is an example of what one of our groups worked on as we were brainstorming which groups and communities they would like to serve. We had some prompts around, let's find 4 communities that you all are part of or you have a passion in, and then the group went forward around, what do we really want to, what are some of them that we want to serve or we have a lot of passion about. So that was some of our work that we worked on for September. And then we also had a Padlet with the communities that the young people are part of and may have the greatest needs, where they have an interest or a passion in. You'll see on here, we removed any identifying pieces as well off of there. So looking forward, this team right now is split into some groups, and they're researching different issues. So maybe mental health, substance misuse, LGBTQ plus issues, and the different communities or populations they would like to focus their energy on. So we're hopeful at the end of our October meeting that they will have determined, where they really want to put their focus and energy for the youth wellness team for this year. And it's not an annual year. It's a July to June project that we're working on. We're on a little bit of an adjusted timeline. So hopefully by the end of October, they'll have that. And in the future, we will have young people that are part of our youth wellness team that will have recorded a short video clip for our learning community calls so that you can actually hear their voice and what they've been working on and what's important from them. So if anybody has any questions, I'll feel free to answer. Oh, there's the baby on the screen. I'm sorry, I was distracted. Does anybody have any questions? Jake, was there
right.
anything else you wanted to add?
I think you covered it. Yeah, it's a work in progress, but we were really energized by the group in our September meeting just a couple weeks ago and all the issues they're looking to focus on. So October and November will really narrow it down, and they'll start putting a really solid plan together. So it's exciting work.
Yeah, we have a question here in the chat. How do you plan to
Yeah.
serve the minority community? So I kind of want to go back to what we had talked about with Youth Advocates for Community Health. The framework we're following is 100% youth-led. So actually the young people are working through this 5-step process, and they're going to determine how they're going to serve the community of their choice that's around health equity. So whether that's a project that's in one community or with one minority group or across the state of Wisconsin, that is not something that we as adults will determine. That's something that the young people that we're working with, so that we have their voice, and they can work on things that matter to them, and then with what they see as young people as issues in their communities.
Thanks for adding that clarity, Jen. I think the important thing for all of us to know too is that as they do their work and share it with all of us here in this space, we will be able to learn from what they do, and also to just hear their voice as a part of the process. So it'll be exciting to see this work continue to unfold, and for us to all continue to get updates along the way as well.
Sorry, Danette, one other thing I was going to add in is that we will also be featuring a different youth wellness team member in the newsletter from here forward. Hopefully for September, we're able to fit that in. So you'll be able to actually, meet the young people and see a little bit about what their passions are, who they are, why they want to contribute to this work, and why it's important to them.
Great, thank you, Jen. Yes, for highlighting that and adding that. All right. And just another comment in the chat. Love hearing that young people are included at the table and in the decision-making process. Absolutely. We know that that's part of what's being asked from DHS of all of you, is to start to include youth. And so at this level, we are expected and want to do the same. And it's an important part of the work that we do at Extension, is elevating and including youth voice. And so again, as we move forward into 2024, kind of the perfect segue. So thank you for sharing that comment. The perfect segue into this next piece is really important to us. I know sometimes when we say like, oh, okay, we're going to put you into breakout rooms, people have an opportunity to just jump off the call. But this is really your opportunity to give us some valuable feedback and ideas of how we can best support you. When I was preparing for today, I found this quote as a part of the YRBS statewide report from a respondent, and it is from a young person, a high school student, that just says, adults need to understand that adolescents don't see that people are truly there to help them. Adults try to tell us how we really feel and don't take time to truly listen. And when we say, I'm okay, we're usually lying. We need help. We want help. We just don't know how to ask for it. And if there isn't a better explanation of why including youth voice as a part of all of our processes and efforts, I feel like that quote right there just sums it all up. So with that, we are going to move you into some small breakout rooms with some guided questions. And we're going to Jake has created a Padlet for us, which is an opportunity for you in your collective spaces in your breakout rooms to have conversation around the questions, and then post your sort of shared and collective answers in this Padlet. You're also welcome to individually put information in the Padlet, but we really want to give you opportunity and space for some dialogue and some conversation, because we know that that's where idea generation can really become rich. And again, we can organically inform this process that we have moving forward into 2024. So again, hearing from you related to how you utilize these learning community calls, what's been helpful, or the office hour session. That's important to us. What could look different? How have you engaged youth in your work so far? We want you to have dialogue around that. And then what support do you need from us? And then what's needed from you or from us to advance your work in 2024 moving forward. So again, we're going to move you into those breakout rooms. We'll give you about 8 minutes in those small group spaces to have some really good conversation around these questions, to populate that Padlet, and then we'll bring you back to the space. We want to introduce you to the website, remind you of the tools and resources that exist there, have a few more opportunities for updates regarding our work for the remainder of this year and moving forward. And then we'll close out our time together today. So Jake, whenever you are ready, you can go ahead and open those spaces unless you have some
Yeah, I was just gonna
instructions for us.
Take a look at the Padlet just so we're all on the same page.
Oh, thank you.
So yeah, here are the different questions. You should see them when you get in there. You'll just, as a refresher, I know we haven't used this in a little while, you'll click the plus sign, and this will allow you to add a post. So adding your thoughts, you can add a subject line, and then here's where you can really fill in the details. Add images if you really would like, or links to other places, but this is kind of how it works. And then just push the plus sign underneath the prompt that you'll be answering. But all right, I'm going to send you all off into breakout rooms, and we'll see you in a little bit.
Thanks, Jake. So must be some good conversation going on in some of those rooms. Not everybody came back immediately, so that's good. Jake, the Padlet link will still be available, correct? So if anyone would like to add additional thoughts that maybe come your way, or wrap up some thoughts that you didn't have an opportunity to finish before you came back into the main room, we can keep that link open. Maybe for the rest of the week, and allow opportunity to share back into that if you would like. So thank you for taking time to provide us that feedback. We certainly do read all of those. We will take it all into consideration as we begin in October to really robustly plan out what 2024 will look like for these learning community calls, as well as the technical assistance that we'll provide all across the board as a part of this work. Before we close out our time today, there's a few other things that I just wanted to talk about briefly. We, in an office hour session, talked about our behavioral health website, and I'm going to take just a second. And Jake, I'll go ahead and screen share if you want, then you don't have to. We'll see if we'll make this work here. There we go. With any luck, you are seeing the website. And in the center of that website, as you look at it, you will see the MCH work there. If you click on that tile and open that page up and scroll down, you'll see the lovely map that Debbie worked incredibly hard on creating, and an opportunity for you to look at the mapped resources. So the map's not there, but the links to the map are there, as well as additional information about what is on that map. As we scroll down, you'll see the learning community call recordings. So you'll be able to find our learning community calls and the recordings there, additional links and resources. So as we share links and information in these calls, and or as Maggie has shared them with us and wanted them us to make sure that we shared them out with you, we will add them to this links and resources page. Information about that youth wellness team, so the patch partnership that we have, and the Youth Advocates for Community Health framework are also located on this page. And an opportunity for you to connect with us, and our email address is here as well. So lots of information available to you there on our website, and we encourage you to go to that space, but also to just reach out to us and share any questions, any comments, any additional needs that you might have around the work that we are doing to support all of you as well. Just as a reminder, we also have office hours coming up. So that is a monthly opportunity for you to connect with us on the second Thursday of every month at 9 o'clock in the morning. We have 3 left for the remainder of the year. We'll be sure to share those topics out in our newsletter and let you know what is coming your way. They're a really great opportunity. We've had relatively small groups, but definitely big enough groups for us to continue this work and this opportunity to come together around a central topic or a theme. Really great conversation and discussion happens in those spaces. If you have suggestions or ideas for what you'd like to see us feature and really focus in on during those office hour sessions, we are always open to that. Multiple times already since we started those, we've adjusted maybe our planned topic because of information or suggestions that really came our way through Maggie or through all of you. So please feel free. Again, send us your ideas for how you'd like us to utilize those office hours, and we will do our best to accommodate those requests as well. As a final note, we have Jake is going to put into the chat our feedback survey. Oh no, we're going to talk about the newsletter first. Sorry, Jake, do you want to share anything about the newsletter before I jump ahead to feedback? I'm all about the feedback today.
Yeah, no problem. I just added to the chat a link to the August newsletter. September newsletter will be coming out in the next week or so. As always, if you have highlights or resources that you want to share, send it on to the youthhealth@extension.wisc.edu email address, and I will be sure to get that stuff added to the newsletter. But yep, that'll continue coming monthly, even if we're not meeting as regularly with the learning community calls until next year. So with that, back to you, Danette, with the survey, which I'll...
Fantastic. And before we do that, I realized I zipped right through the Padlet, right? I was excited to keep us moving forward. And I didn't pause to give anyone an opportunity to maybe ask any questions of us from those Padlet questions, or if anyone made a comment on the Padlet and you just wanted to share a bit more with us about what your thoughts were that you shared on those Padlet responses. So any questions, any additional information you want us to know, now's your chance to discuss that. We've got just a few minutes of time left in our time together today. All right. Those Padlets are helpful. Oh, go ahead. Yeah.
No, just one comment. If somebody had made a comment about the format of the meetings be a little bit confusing for them, how we have learning community calls and office hours. So if you want to even just send one of us a message, or if you want to unmute and give a little bit more information around that, so we can kind of give a further explanation. We've been doing quarterly learning community calls and then monthly office hours. And the office hours are formatted where we usually have a content expert that's talking around a specific topic that one of the local tribal health departments has said, like, there's a need, or we've heard a lot around that. So that's where we're getting those topics from. And those are about an hour long. And there's a lot of Q&A, a lot of time to be able to learn from other health departments. And I don't know if you have anything else to add besides that.
No, that was great summary. The only thing I would add is just to amplify what Jen said. Lots of opportunity to ask questions, but also to really think as a small group, because again, those are typically smaller groups that are coming together around that particular topic or interest area, and think about how we could really utilize what we've learned, or how we can learn and grow from each other in those spaces. So again, a bit more topic focused, and we've tried to keep the learning communities a little more broad, that are topics that would hopefully touch on and support all local and tribal health departments across the state. So that's how we've sort of separated those opportunities.
Also, Danette, that chance to reiterate that if there is, it does seem like there's quite a few comments around engaging youth, you know, being difficult and where knowing where to start. We definitely, if you just send us an email or even a quick message on here, if you need any technical assistance around that, we're happy to meet with you via Zoom, depending on location, coming to your location, determining what your needs are. We have a lot of different tools that are available to help work through some of those difficulties. So please, please do reach out. Danette, when is the next meeting? We have that in the chat here.
That's a great question. So this is the final learning community call for 2023, and we are in the process of building out our scope of work and our plan for 2024. So we don't have a date yet, but as soon as we have all the dates identified for 2024, we will share those out with everyone so you can get them on your calendars. We plan to spend the month of October getting all of that information solidified. And again, we'll get it out as soon as possible so you have them on your calendar. Thanks for asking that question, though. All right, with that, we are going to share a Qualtrics link to give you an opportunity to give us some feedback on this call in particular. And I will apologize in advance. We spent a lot of time trying to revise and update this Qualtrics link, and it was a little bit hit or miss on if it was giving us the older version or the newer version for Jake and I as we were preparing for our call today. So if it says, thank you for attending the April call, that's okay. Go ahead and complete the survey. We did try to update it, but it may not be reflecting all of the changes that we created in there. So you could just go ahead and follow the link and provide us with any feedback. We really value that. And with that, thank you again for taking the time to be with us here today. If anyone wants to stay on, ask any questions of us directly in this space, you're welcome to do that, as well as don't hesitate to reach out via our youth health email. Thank you, and I hope you have a great rest of your week as well.